Hey, what's up, everyone? Dr. Bo here, Pierce Chiropractic. I am responding to a message I got here. I thought I'd write it down and then I would tell you guys the answer. We get questions all the times in our DMs at Pierce Chiropractic, and one person asked, Bo, what are a few conditions that you as a chiropractor take care of and treat that most people would never associate with chiropractic? I thought this was a super powerful question, and hence the response. So I'm gonna give you guys 5 things that we see very typically in the office besides like your traditional like lower back pain or headache or sciatica. These are things that we see every single day. So the first thing I see a lot of lately is TMJ disorder. So clicking, popping, grinding. There is a lot of studies and research show having to do with the alignment of the jaw, as well as working all of the muscles around it to get the TMJ properly working. So if you have TMJ stuff, we can definitely help with that. Second thing, this is huge right now. I don't know why we're seeing so much of it. Vertigo. I'm seeing so many people with vertigo coming into the practice. Now, I know COVID is kind of quote unquote back, and one of the side effects of COVID is vertigo, but I'm seeing a ton of patients that are saying, Bo, I'm so dizzy all the time, getting a lot of vertigo symptoms. We address that by addressing the upper cervical region because those are the areas that work with the ears to help create equilibrium and balance in the body. So by adjusting the upper cervical, the atlas and axis, that can help restore and get rid of the vertigo. The third thing, ton of this lately, plantar fasciitis. So a lot of people are outside, they're running, bottom of their feet start hurting. Maybe they go to the podiatrist, they give them orthotics, and they push them out the door, and they have no idea what else to do. So plantar fasciitis is something I see quite a bit as well. How do we address it? We address the structural components, so we adjust the foot, as well as shockwave therapy. Guys, shockwave therapy may be the coolest, best thing that I've seen in 15 years of practice. It sends acoustic shockwaves down into the tissue that is injured or not healing, vibrates it, releases stem cells. Chronic pain, chronic injuries that you've had for years, I'm telling you, shoulders, knees, wrists, feet, and plantar fasciitis works so incredibly good. And the cool part about it is you don't need tons and tons of sessions. 5 to 10 sessions over a period of about 3 weeks, and like 95% of plantar fasciitis cases are gone. Here's one. It may be called, if you guys who know this term, Eustachian tube disorder. Basically, what that means is little kids that have ear infections. We do amazing work with getting kids' ear infections to go away without using medicine and antibiotics. It's all about, again, rebalancing the upper cervical. Kids, especially little ones, their ear tubes are not pointed down like ours because their face hasn't grown. So they sit more horizontal. Bacteria sits in there. If their neck's out of alignment, it kind of creates a little safe harbor for it. Those kids that have chronic ear infections, I'm telling you guys, chiropractic works miracles. All right, and then the last one. This one comes in. This is probably actually the second most treated thing that I see in the practice. And people would say, oh, sciatica and headaches. No, no, no. This is what it is: sternocostal dysfunction. Basically, what that means is this: have you ever felt like you're having a heart attack? Like you have pain in the front of your chest, it's wrapping around all the way underneath your shoulder blade pain. Guys, those are your ribs being out of alignment. What does that mean? That means we all know we have our spine, but we have ribs that connect. They wrap all the way around to the front, and they aren't hard connected like bone on bone. They kind of sit out like a little bit of a joint because there's a capsule that surrounds it because it has to expand and contract with our lungs. But sometimes with pushing or pulling or rolling over or sleeping, those rib heads can get pulled out of alignment, stretching the capsule, and then all the muscles spasm around it. Next thing you know, the patient thinks, oh my God, I may have a heart attack. I got left-sided pain. It's going down my arm. This is bad. They go to the ER. They don't know what's wrong with them. They send them home. Guys, this is rib dysfunction. This is classic stuff that we see. We do amazing work with this. Literally, this is one of those ones where you kind of go to the chiropractor and they adjust you and you get off the table and you're like, oh my God, I feel like 95% better already. Like that was amazing. And yes, so this is something I honestly probably see 5 cases of this a day in my practice. So yeah, so sternocostal or rib dysfunction, those are things that we see a lot of. First off, thank you guys so much for the question like this. I need to make more videos like this because I think a lot of times people just pigeonhole chiropractic. They say, oh, I went in with this and this is the only thing that you do. And I get that because medicine in itself is very specialized these days. But as far as chiropractic care, my job is to restore function into the spine, allow the nervous system to work, and then the body to heal and operate at its highest level. So if you guys have questions about any of these 5 conditions, TMJ, vertigo, plantar fasciitis, kids with ear infections, rib dysfunction, hit me up. Let me know. That's what I'm here for. Thanks for taking a listen to you guys. If you have experience with this as well, comment down below. I'd be curious just to see what you guys think about it. All right. Have a great day. Bye.